All right. Good afternoon and welcome to the Dibble Institute September 2021 webinar, Piloting Mind Matters with Hispanic Youth During COVID-19. I am Rachel Savasic-Luxton, the Director of Research and Training with the Dibble Institute, and we'll be introducing the presenters here in just a moment. But before we do, I do want to say hello and thank you to Esther, who is behind the scenes and helping us run things during today's session. So hi, Esther. Thanks.
Hello.
And hey. And before we get into introducing our wonderful presenters and their session, I just want to give a little bit of background about Dibble Institute and kind of the story and the development of Dibble, because oftentimes we're asked, where does the name the Dibble Institute come from? So I just wanted to take a short minute to explain that there was a Charlie Dibble, and he was the founder of the Institute. He was an aeronautical engineer who, in his retirement, was really dedicated to working with young people. And during that time, he started to really see the challenges that youth were facing, and just really, it became evident during the late 80s at his grandniece's wedding, when he heard her, and he had heard this from others, that, oh, Uncle Charlie, this is just my first wedding. And so at that point, after seeing what he had been seeing and then hearing that, he decided it was really time to do something to help young people feel more confident in navigating their romantic lives and achieving kind of the future goals they have set for themselves. And because Charlie was a Mr. Fix-It, he looked to the field to see what information was out there and what was being done to address the needs of young people. And while there were a lot of resources targeting adults, he quickly realized that there was little being done to address the needs of young people, especially in this realm of forming healthy relationships. So with the cooperation of some different business colleagues and friends, Charlie founded the Dibble Fund, which is now known as the Dibble Institute. So I'll give you a little bit of background, a little bit more background about the Institute itself. We are a national independent nonprofit organization. And last year, if you look at the map that you see on this slide here, we had orders from over 43 states in the nation. And this means, when we look at numbers kind of conservatively, we reached over 67,000 young people. And this doesn't include folks from years prior. This is just 2019 to 2020. And that's quite the impact. So not only are we grateful to Charlie, but we're also grateful to all of you too who are here on this webinar, and even those of you who are maybe watching it after, if you aren't able to attend our live session, who are out there and really working with the youth, providing those direct services. So thank you for all that you do. And because we are an independent nonprofit organization, this means we are missions and values driven. So let's talk a little bit more about what that means for Dibble by highlighting our mission and what really guides us. So our mission in all of the work that we do is to empower teens and young adults with knowledge and research-based skills to help successfully navigate their intimate relationships. And what you'll see in this mission is some of our key values are also being highlighted. And the first one being that we believe in research. So all of the programs that we have are research-based, and this also means that we strive to have our programs evaluated at the highest levels, and really like to highlight things like the presentation we have today, where more research is being done to demonstrate the impact of the curriculum that we publish here with the youth that you are serving in your communities. The other value of ours is that we believe in stable, safe, and nurturing families, and that everyone should have this in their lives, which is why the programs that we create and publish and promote are so important to kind of help this throughout our nation, and even internationally, as we are being used beyond the US, which is pretty exciting. And we also believe that relationship education is for everyone, and that everyone should have access and ability to learn the skills and develop the knowledge and tools to successfully and safely navigate their romantic lives and their intimate lives in general. Which brings us to today's webinar. And I want to briefly introduce our presenters, and then I'll turn it over to them in just a moment here. So first I want to highlight Dr. Heidi Rueda, who was an associate professor at the University of Texas, San Antonio in the Department of Social Work. She graduated with degrees in Spanish and psychology from the University of Nebraska and got her master's and PhD in social work from Arizona State University. Her areas of interest include healthy relationships, disability, and health and well-being. And she has 48 presentations at 13 national and international conferences, 36 peer-reviewed journal articles, and an invited book on the topic of sexual health among individuals with disabilities. She's very passionate about a holistic approach to physical and mental health. And as she herself has been on an 8-year recovery from chronic fatigue syndrome. So Heidi, or Dr. Rueda, is joined on the later half of this presentation by 3 Masters of Social Work graduate students. So we have Arminda, and I will let Arminda pronounce her last name because I don't want to, get that wrong. I feel like I might. And then we also have Katherine Perry and Abigail Vera, which I might have mispronounced those 2. So if I did, please correct me when you hop on. 2 of them have actually graduated and obtained social work licensure, so congratulations. And they were really fundamental to the delivery of the program and subsequently the evaluation. But before I turn it over officially, I do want to point out that there are some handouts available to you in the control panel. So we encourage you to check those out and download them. And you can also find a question box over in that control panel. I'll be monitoring that as we go throughout the presentation, and we do have time built in at the end for some Q&A with our presenters. And with that, I will turn it over to Dr. Heidi Rueda.
Hello, I'm going to actually turn it over before I even get started to Kat Perry, who's going to lead us in an introductory activity, mirroring that of the Mind Matters program. So sit back and relax, everyone.
Hi, everyone. So today we are going to start off our webinar with setting the intention with our 5, 4, 3, 2, 1 exercise, which we did with the kiddos when we presented. So if everyone wants to get into a comfortable position, somewhere that they just can feel relaxed, why we do the 5, 4, 3, 2, 1 skill is it's a self-soothing method. It's particularly effective if you're overwhelmed or have lost track of the present. So the first thing I'd like you to do is to find 5 objects around you. Relax and focus on what you see. These could be buildings, windows, pictures, or clouds. Consider their shapes, colors. Consider how they relate to each other. Are they geometric or symmetric? Then we're going to have you listen to 4 different sounds around you. We're doing the same thing with hearing. You can close your eyes if you're in your place where you feel it would be appropriate. This might be the quiet hum of the air conditioner, the roaring wheels of a train, the distant noise of traffic, or birds chirping high above. Now focus on 3 body sensations. This might be the pressure of the chair against your back, the tight fit of your shoes against your feet, the soft stream of air through your hair, or the warmth of the sun on your face. Now focus on 2 odors you can smell. It might be the remains of the perfume used when leaving home, a snack, or maybe freshly cut grass. And finally, focus on 1 taste in your mouth. Every day, you can enhance this in a moment of stopping and slowing down and paying attention to something wonderful around you. The 5, 4, 3, 2, 1 skill can help you do that. Thank you.
Okay, thank you, Katherine. So now that we're all sufficiently rested and here, I just want to introduce myself. I'm Dr. Heidi Rueda, and I'm really excited to be on this webinar. This webinar has personal significance to me in that it's a chance for me to build mental health advocacy as Rachel noted, I've been on an 8-year recovery journey myself from chronic fatigue syndrome, which is a nervous system condition. So my interest in the Mind Matters program was to help youth like myself who maybe didn't receive the tools that they needed when they were younger to be able to regulate their nervous system, especially when impacted by adverse childhood events. And so I've used many of the tools throughout the Mind Matters curriculum, and I also learned more through using that curriculum. And I just think that, I just really align with the mission of the Dibble Institute in putting this out, so I'm very thankful. Also, the collaboration that was formed with a community-based organization. This was in the heart of a large urban city in the South, saying that to protect the confidentiality of that agency. Some of the folks from that agency are here today, so I just want to give a shout out and hello, and thank you so much for the collaboration and the opportunity to pilot this program with Hispanic youth in this highly vulnerable area of the city where we did this. And today, of course, you're probably here to hear more about this pilot evaluation. And so I'm going to give a little bit of background on trauma and resiliency, and then we're going to talk about youth perceptions of the program as well as staff perceptions of the program. So I'm also really excited that Katherine, Arminda, and Abby are here today because they were really integral to the implementation of the program with middle and high schoolers as well as its evaluation. And so they're going to give their perspectives on what it was like to deliver the program and any adaptations that were made, challenges faced, as well as what worked really well for them while delivering the program. So next slide. Okay, so I noticed from the registration that many of y'all were social workers, counselors, worked already in the helping profession, but I think it's worthwhile to speak a little bit about what is trauma. So what we're beginning to understand through research is that the brain is always scanning for threats to safety, and these include relationship safety. So for kids who have experienced early childhood trauma, also known as adverse childhood events or ACEs, the body's nervous system can enter into or get primed for stuckness, essentially sympathetic dominance, which, the sympathetic nervous system, it's responsible for getting us to run or freeze or fight in situations where we're unsafe. For example, if we're getting chased by a tiger. This is the opposite, though, of the rest and digest response that we're supposed to be in most of the time, which is the parasympathetic response. So no worries if you don't understand the terminology too well. It's just essentially our nervous system has different modes of functioning, and we're supposed to be in a calm, relaxed state most of the time, and we can get stuck when our bodies perceive threats. So that can be from an unstable environment where there is inconsistent or challenging situations to the child and to their ability to function. And we see this often as our immune systems are compromised. We see kiddos complaining of digestion issues, stomach aches, brain fog or cognitive issues, difficulty thinking clearly in school, and all kinds of other stress response physiological indicators. So some examples of adverse childhood events include psychological, physical, and sexual abuse, exposure to family violence, and other forms of household dysfunction. So that can be substance use or parents with one or more mental illnesses or disabilities, as well as being in the foster care system, or otherwise experiencing parental or kinship transitions. So we know that many kids are exposed to these kinds of stressors today, and within the last couple of years have also been coping with the health challenge and fears associated with COVID-19 and the pandemic. So this has really disrupted youth's lives in terms of stability and routine. Also, many parents have lost jobs, and many youth have lost parents. So all while lacking the social supports that would normally have been there through peer interactions and interactions with other adults, other caring adults in their environments. It's noteworthy, I think, that trauma is somewhat subjective and that various challenges can impact us in different ways. So one individual, this is just kind of a whimsical example, but it could be perceived as traumatic for a kid who may trip and fall in front of their peers. And one kid may stand up, laugh it off, and take a bow, while another kid may remember this event as extremely embarrassing and as evidence that they're strange or unlikable. So in this example, I just wanted to throw this out because we see that one's beliefs about themselves and within their environment intersect with relationship context to impact the ways in which their development is enhanced or deterred. So trauma is complex, and what's less understood to healing trauma is that it requires not only a cognitive approach to reframing these thoughts and beliefs, but also addressing the core issue of the nervous system's sympathetic dominance, meaning that fight, or flight that the body can get into. So when that can happen, if you think about when you're sick, is it sufficient to tell yourself to just calm down or to make a gratitude list? These things can be helpful, and we know that our thoughts are linked to our immune system response, but ultimately your body also needs specific components to be able to heal effectively. So water, sleep, nutrition, relaxation. And so what I really loved about the Dibble Institute's Mind Matters is that they incorporate the latest in neuroscience to also understand how we can use body-based or somatic approaches to return the body to its healthy nervous system functioning. So the cognitive psychoeducational component is important, but so are the body-based regulation, self-regulation, and soothing components. And since early intervention is rare, early childhood trauma according to research, is often detrimental not only to the child, but into their adolescence and adulthood. So we see that kids who are exposed to especially cumulative or prolonged stress in childhood, they are more likely to have mental challenges into adulthood, physical challenges, and illness. So having early programming, including wraparound services, is really important. Next slide, please. Okay, so some sources of cumulative stress, I mentioned that that's a really important indicator in terms of how trauma is experienced, is that, youth in communities marked by poverty, they're exposed to more of these cumulative stressors and across multiple contexts, so meaning home, school, community, their environments, right? And so where we conducted this study ranks among the most poor in the state. It has a high Hispanic population, which entails additional stressors potentially, such as linguistic isolation. And then also, and I'll talk about this in a bit, there are both cultural strengths and potential disadvantages when we were looking at coping with trauma, for example, help seeking among the Hispanic population. The zip code also had low levels of educational attainment, high crime rates, negative health trends, adverse family trends, so higher rates of child abuse and neglect, and it also had one of the highest rates of COVID-19 deaths in the US. So when we think about our target population being primarily Hispanic youth, we also need to think about societal stressors, including discrimination, historic discrimination, and acculturation and acculturative stressors. Next slide. Okay, so we've talked a lot about stress so far, and we know that even just talking about stress can actually make us feel a little bit stressed out sometimes. So it's some good news for you. And we have a pretty good idea by now of what trauma is, and that y'all are pretty well versed in working with kids who experience trauma. So let's talk more about resiliency building. Resiliency building is both preventative and an intervention. So I like to use the term preventative intervention because it serves as an intervention for our taxed and traumatized nervous system. It also prevents issues associated with that. So essentially, resiliency is our ability to bounce back, and denotes an integration of cognitive, biological, and social or interpersonal assets. So some examples of resiliency building that have been supported by research include having close relationships with caring adults and access to those supportive relationships, so social protective factors. And then some of the skills that we'll be talking about within the Mind Matters program, which help to mitigate stress and contribute to overall well-being. So I mentioned earlier that resiliency building includes a cognitive piece. So there's cognitive appraisals of events or challenges as important to nervous system regulation or dysregulation. So in other words, how the youth is perceiving the event is important, or the cumulative events or stressors. Part of that is being able to identify and be mindful and notice what those stressors may be and how they impact the body. So there's that psychoeducational component. There's an emotional component, right? When we become aware of our thoughts and we become aware of potential stressors in our environment, we also begin to notice emotions in the body. And part of healing from trauma is being able to not only notice those, but allow those and be able to be with those emotions that are present with compassion. So I mentioned somatic and body-centered approaches to trauma recovery. Those are increasingly favored by trauma experts. And then social and interpersonal relationships are important assets. And this is really starting to be understood through polyvagal theory, for example, the critical component to our nervous system functioning that is our social and interpersonal relationships, our relationships with ourselves and with others. So I say this because it's really important for staff who are working with youth to also be trained in these same ideas, right? And understand co-regulation and positive reinforcement to create a safe environment. So essentially adults need to also know these skills so that they can co-regulate youth emotionally and within their bodies. So some techniques, for example, well, when we're just already regulated, we tend to speak more slowly, use a little bit lower tone in our voice, and we can do a number of these activities ourselves, such as being mindful of our breath and of how we're interacting with youth, so that we're not going like this and we're stressed and also regulating them and dysregulating them in that sense, right? So that's just one example. So this is really important, I think, for adults. We know that adults don't necessarily have these skills either. So I think the practitioners later in this webinar will talk to you a little bit about how they also benefited from learning what the curriculum entailed. So next slide. Okay, so why reach youth and adolescents? So youth are learning to individuate during this time period, right? So this requires their increasing ability to cope with stress and to handle stressors. So we know from research on the brain that this is a rapid time of development, and that at this time period in adolescence, the emotional aspects of the brain are more developed than the rational thinking parts of the brain or the prefrontal cortex. So this comes with heightened emotionality. So it's a great time to teach emotion regulation and how to process emotions in a healthy way. And this is also part of identity formation. So youth are starting to ask questions like, who am I in comparison to my peers? And relationships really play a key role, including dating relationships, actually, in youth's ability to cope with stressors and to regulate. And so when we think about our Hispanic youth population, we also know that ethnic identity is forming, and we can use that as an asset to promote youth resiliency. Cultural norms are being negotiated within a larger mainstream framework. So some protective assets are strong family bonds and ties. Religiosity offers hope, especially for healing from trauma. And then some potential stressors that can come with that include help-seeking norms. So all the more reason to deliver these modalities, to deliver programs like Mind Matters where youth will receive them, because traditionally Hispanic families are less likely to seek help, at least from professional sources. So reaching youth in churches or in the communities in which they play and adults work make more sense for a wraparound way of viewing and supporting our Hispanic youth. And then sometimes rigid gender norms. I mean, that really has to do more with trying to navigate different cultural norms for youth, which can be a stressor, right? And can contribute to a culturative stress. So what I'm seeing at home and being modeled and reinforced there versus maybe what I see in the media or among my peers, and this time of adolescence as identity forming, and a time where I'm trying to integrate all this and think about what I think and I believe, and that can stir up a lot of stress potentially and emotionality. So, and as well, physical bodies are also rapidly changing. So it's a critical time to negotiate those adverse childhood events that are starting to potentially impact the nervous system if not dealt with in a healthy way. And I mentioned some of the things that can come if youth are having trouble in this way, including digestion issues, headaches, fatigue. We see the same things with adults, right? So in addition to things like Mind Matters, being the basic tenets of health are important, and I want to make sure I say that, things like sleep and nutrition and exercise, and some of that actually is integrated into the program. And I do just want to mention as well with COVID-19 that another potential stressor for youth, and Hispanic youth in particular, is that sometimes these youth serve as brokers to the mainstream culture. So this can come with challenges such as translating, finding health care resources for family members, death and funerals of loved ones and extended family, which can include in Mexico, and helping to make those arrangements. So there's, again, that broker role that can come with challenges, but also can serve to strengthen family ties. Okay, next slide. So, oh, this is Arminda. Arminda, I'll turn it over to you, sister.
Hello, everybody. So choosing the Mind Matters curriculum, it was chosen for its integration of the latest research from neuroscience and trauma recovery. So each of the following core components, as you see below, of the program have been scientifically shown to improve youth resilience and to help youth recover from trauma. Next slide, please. Okay, so the Mind Matters curriculum is comprised of 12 one-hour lessons. These lessons are also available in 21 shorter lessons as a virtual curriculum and a digital version. So it's for youth ages 12 and up. It was adopted by 36 states and internationally. So it's aligned with Tier 1 and Tier 2 of the social emotional learning support, which means that this can be used for general education and in small groups. So authors are Caroline Curtis, PhD, and Charles Schlotzenbach, LMFT. Next slide, please. Okay, so the 12 lessons in Mind Matters. If any of you guys have any questions or want further information or details on what these lessons comprise, you guys can ask us during our Q&A section. And just to list them down, self-soothing is the first lesson, discovery of emotions. The second, understanding the difference between thoughts and emotions, building empathy, building a support system, having compassion for a traumatized brain, trauma containment in rhythm, tapping and sleep, exercise, goal setting, asking for help, and designing a personal contract. Okay, next slide, please. Okay, so we are going to be moving on to another little exercise. So this is the loving kindness exercise. It's another exercise, a little activity that's in the Mind Matters curriculum. And the purpose of this exercise is to increase compassion for yourself and for others. So we're going to start with section 1, which is for yourself. And you guys can just repeat after me. So, may I be safe and protected. May I be peaceful and happy. May I be healthy and strong. May I be at ease accepting the changing conditions of life. Okay, now we move on to section 2, which is for others. And for others, you can choose a person you love, you can choose a close friend, you can choose a person that you are neutral with, you may neither dislike them or like them, or you can even choose your pet. So we're gonna do the other section. May you be safe and protected. May you be peaceful and happy. May you be healthy and strong. And may you be at ease accepting the changing conditions of life. And that's it. So you can really do it with yourself daily, once a day, in the morning and at night, or you can do it to others as well when someone is nice to you or you just want to lift someone's spirits up. So thank you so much. Next slide.
Hello, everyone. So for the present study, the evaluation component includes 3 factors of assessment. The first one being pre-adolescent and adolescent youth perceptions of the program. The next one, their experience using the resiliency building skills taught. And The third one, the extent to which they remembered and utilized these skills after the program, right? What from the program was salient for them? The present study is a part of a mixed method pilot evaluation where we also collected data from practitioners and the observer through a fidelity log and survey questionnaire that touched on challenges encountered with the lessons, as well as how closely the program was followed and any adaptations that were made. For the purpose of this presentation, we were going to touch on youth perception data as well as practitioner perspectives and what it was like to observe both groups in action during program facilitation. Next slide, please. There were 14 participants total, and they were split into two groups according to age. So we had pre-adolescent and adolescent youth, with 2 who self-identified as male and 3 who identified as female in the former group, and 5 who identified as male and 4 who identified as female in the latter group. Youth primarily self-identified as Hispanic. The program took place over a 3-month period during the fall of 2019, with 12 in-person after-school lessons. Immediately after the program, assessment was conducted through focus groups with each group separately. So these focus groups centered on questions to help elicit youth perspectives on the program, such as what they liked, what they learned, and suggestions for improvement. 3 months later, during the spring of 2020, assessment was conducted again through individual phone interviews while the youth were at home due to the COVID-19 pandemic. For this part of the assessment, we worked with the after-school programs agency to follow up with the youth. They made diligent attempts to reach all youth participants, though only 5 responded. 3 were Hispanic adolescent females and 2 were Hispanic pre-adolescents, 1 male and 1 female. These interviews were conducted to help capture how the youth were during the pandemic and they remembered, and what they remembered from the program, and if and how they were utilizing what they learned. So this unique time frame contributes to our understanding of how resiliency-based skills can be taught and later practiced by youth during difficult and potentially traumatic historical experiences. Next slide, please.
Okay, hello again. This time I'm going to share my webcam so y'all can see me. So thank you, Abby. Abby was an observer of all of these lessons. So she did a great job of collecting data for us. If you want to go ahead to the next slide, I can talk about the results. So as Abby mentioned, we were primarily interested in this pilot evaluation. It was more of a formative evaluation where we were assessing youth perceptions of the program as well as the acceptability and fidelity with regard to practitioners. So how well practitioners were able to deliver the program, what were some of their challenges, what worked well. And so they'll talk about that. We're still in the process of analyzing those in a more systematic way. So we're working on a manuscript. You can look for it in the future, or feel free to email me with any questions or if you'd like to receive the manuscript down the road. But we analyzed more systematically to this point youth perceptions of the program, utilizing the immediate focus groups after the 12 lessons. And then we also had the really unique opportunity to follow these youth through COVID-19 as that unexpected pandemic came up right after the delivery of the program. So we followed them 3 months later by phone. And I want to give a shout out to a person who's here. I will keep her name confidential, but she helped us to actually conduct those phone interviews with youth right after they had gone home for spring break and were coping with all the challenges that come with COVID-19 and doing school from home. So one of the big questions we had was how acceptable or how well will this program be received by Hispanic youth? So one of the quotes that we like as a group was, "It was weird, but fun." I don't want it to be over. It's really fun. I didn't know that all of this had something to do with me, but then I'm like, oh my God, I always feel this. I always do that. Like, this is describing me. I'm so glad I've done this program. So those are just a few of the quotes. And overall, from all the youth, taken together, youth described the program as interactive. They felt that it was relevant to their lives. It fostered self-discovery. And then there was they found it applicable to their daily lives and were using the tools. There was some youth who felt like the tools were strange or really novel or different to them. And there was just one youth who noted, and this was more from an observer point of view. She didn't talk about it in the focus groups, but there was one youth who was challenged in discussing some of the adverse childhood events, specifically abuse in the home. So we'll talk about that in the discussion, what to take away from that. But overall, the program was highly acceptable to youth and relevant. So the next thing we wanted to know was, according to youth, what had they learned from the program? And they described, I'll use a couple of quotes here, the focused breathing to like calm down and to just like have a little moment to yourself when like you can't really understand the schoolwork and you're getting really frustrated about it. And I like that quote because it speaks to how they're using these tools in very relevant, stressful situations for them. And then the psychoeducational component about trauma. So a lot of comments from youth had to do with what they learned about trauma, just having that be a really novel concept, that some of these challenges meant that they might have difficulty with regard to self-regulating, and it kind of helped to normalize and explain some of the challenges that can come. So this one thing where you're like abused as a child, you're at higher risk for heart disease. So just a quote to demonstrate some of the psychoeducational components that they had learned as well. Some youth also described how it helped them to get along. There were some youth actually in our group who had some relationship challenges at the start, and they felt that the program helped them to have that peer support and to actually work through some of those challenges, and that they had learned emotion regulation and self-soothing were the components of the program. So if you think back to all those different lessons, we thought that was pretty interesting, that the things that they chose to focus on in their descriptions of the program really had to do with the skills that were taught around self-soothing and emotion regulation, more so than, and this may not necessarily be that these weren't salient, but than the goal setting or the, there were other asset building skills. So exercise was talked about in the program. There were a number of intention setting, right? Mentoring and receiving support. So some of these things were talked about a little bit, but those things that the youth kept coming back to were those actual skills that they were practicing. Next slide, please. So we asked them about what they liked best and what they liked least, or areas for improvement. And so what they liked best, and this mirrors what I was just saying, is that they liked the activities, the interactive nature, and the tools that they could take home and use. The body scan was something that they really enjoyed, and that's something that they did to scan each part of the body in a relaxed way. Again, I mentioned earlier the importance of being able to be with what's in the body, even when it's uncomfortable. So that's part of this exercise, is being with body sensations without judging them as bad, but as information about the state of a person's nervous system. And so utilizing that body scanning, focused breathing and counting, we're doing some of these types of exercises for y'all today. And then the Marshmallow Challenge, that's been empirically supported for quite a while now, and utilized with various youth. And this has to do with waiting for developing patience, or assessing the extent to which youth can be patient to for an anticipated positive result. So, you know, being given something if they can wait for it. So they're given a marshmallow and told there would be an opportunity for something positive if they waited to eat it. And then some of the things that they noted as potential improvements to the program had to do quite a bit, especially for the middle school group, with sitting still for the program, especially, you know, after school, coming straight to an after school setting. Didn't like sitting down, had a lot of energy. Also, some things went over their heads a bit. It was a bit confusing for some of them, especially the younger youth. They said they wanted things a little bit simpler. And then, oh, actually, this was talked about a little bit. So this youth who said that she felt uncomfortable, that was the youth I mentioned earlier, and went under the table. So, so that's something to know with regard to the importance of having training around how to handle situations, including trauma that may arise for the youth as as these groups are being run. Next slide, please. Okay. And then we followed up with youth, and 3 months later, and youth still spoke about benefiting from the program, and we were impressed that they were able to remember many of the self-soothing skills. So the ones that we just mentioned, or that I spoke about just now, the breathing and the body scanning, and they had been utilizing them and offered examples of how they'd utilize those during the pandemic. Nearly all the youth interviewed said that they would do the program again. And so that came up from they wanted to know if they were going to participate again. So go ahead and move forward. Okay, so there's, I think, a lot, just even from the small pilot study of youth's perspective so far, to take away when using the program with Hispanic youth. I think it's noteworthy that it was well received by Hispanic youth, especially if we think about the ways in which mindfulness and yoga and these different self-soothing, emotional regulation tools and techniques are popularized. If you look in like magazines, it's oftentimes white women who are being depicted. So I think that it's neat that youth were receiving this program well, and we weren't sure if that was going to come up, and it didn't. And that may be also that, you know, that kids, that mental health is more available. Discussion of mental health is more available to youth now than it was before. It's almost trending. And so one of the cultural barriers that we were thinking about was that while it may be more receptive among peers to talk about things like, I'm triggered, I'm going to take 10, you know, and to practice these skills, that we wondered about home receptivity. So we'd like to see future adaptations include an element that extends beyond the youth to include parents and community. So we see this with trauma-informed approaches to schools and to community centers. So that's a step in the right direction. But kids may have also taught family members. One of the youth said that she had taught her younger sibling some of the skills. And you know, youth felt that the program was applicable to their daily lives. I think what's important also with regard to this pilot study was that the youth in this setting, and after school setting, they had access to case management, to wraparound services, which offered help into the community to Hispanic families to whom, you know, may not have otherwise received them. And the agency itself, where this program was delivered, had a trauma-informed approach at the agency, which included training for staff and included training for these MSW. At the time, they were interns who ran the program, as well as oversight by a licensed mental health professional. In this case, was a licensed social worker. So, you know, this was received really well by the community. It actually made the front page of the newspaper. And so I think that this has to do with a hunger for these types of skills and for this mental health recognition by the larger public and by adults as well. So, you know, and I'm excited as well for the Q&A and for any comments that y'all might have. I know a lot of you work with Hispanic youth and families, and you may have some other discussion points that we haven't thought of, as well as we're sorting out some of these results and thinking about the implications. And then we also just think it's important to have done this program and for youth to be able to utilize these skills during COVID-19, and are excited that the Dibble Institute is now, they've developed an online set of modules. And with regard to some of the youth feeling confused or overwhelmed by the content, it had us thinking about also the importance of offering the smaller modules that the Dibble Institute offers if the context will allow it. So we just had that one semester to get this curriculum in, so the 12 weeks were perfect for us, but there is a 21 lesson abbreviated version. So Dibble is on it, and we're excited about the adaptations they've already been making. I think including things like acculturative stress and help-seeking norms, and even dating and gender expectations for Hispanic youth, as well as ethnic identity formation and some of the protective assets of strong family ties, and forming a strong sense of biculturalism and ethnic identity can be really important, as well as including family and parents for Hispanic youth. So I will go to the next slide. I believe that I'm going to pass it on from here. Yeah, so I'm going to introduce and welcome the practitioners who delivered this program, and I have quite a bit to say as well about their own experiences delivering it and observing this, and then we'll end today's session at the conclusion with a final activity. So it's been really nice to have you all on board, and like I said, if after the practitioners give their perspectives and we do a wrap-up activity, anyone has questions for me or would like to send me an email at any time about these things, I'm also open to that. So I'm just really grateful for y'all to be here today. Arminda, I will turn it over to you.
Hello again, everybody. So I was in charge, and I facilitated the middle school group, and this consisted of kiddos 12 to 13 years old. Right away, we noticed that they had a lot of energy and they were always on their electronics. So we had to create rules because they were very distracted. So we created rules, and one of the rules was to prohibit electronics. They weren't allowed to have their phones with them or their tablets, and we brought in fidget toys. So they would exchange their phones, their tablets for a fidget toy at the beginning of the lesson. And we felt this really helped a lot. The rules helped create a structure, and then the fidget toys, they were able to focus more on the lesson. So with a younger group, definitely try to create some rules and definitely bring in fidget toys because they were really helpful. The participants enjoyed the Marshmallow Activity, which was the activity that reduces reactivity. So they testing their patience in a sense, and they enjoyed watching the clip of the movie Inside Out, which was for lesson 2 in discovering emotions. I remember the participants being excited for both activities, and it was something that really stuck to them in the end, and they remember those activities the most. So in my experience during the ACEs lesson, when we were talking about the ACEs and providing the kiddos with information about ACEs, one of the participants felt very uncomfortable, and this happened in the middle school group where she just didn't feel comfortable discussing the topic, and her reaction was to go underneath a table, and she didn't want to participate in the ACEs questionnaire that came with that lesson as well. And I remember the other participants felt very awkward with her reaction. They were very familiar with one another, and they've never seen her react in that way, so they felt awkward. So what we did in the lesson is we allowed her to do what made her feel comfortable, which she remained under the table for the remainder of the lesson, and she had the option to not participate in the questionnaire. And I remember this being my most challenging lesson because I had a moment where I didn't know what to do when she, had that, when she was triggered. It was a little like, oh, what do I do? So in this lesson in particular, it's very, very important that you do come prepared to the ACEs, and specifically prepared in knowing what to do and what to say if a participant is triggered. I know for this participant afterwards, I did speak with her, and I guess just to see how she was feeling, and she received individual sessions where she was able to process her emotions. And like Dr. Rueda said, this was a great setting because she was able to receive that extra attention afterwards. Overall, it was a great experience for the kids. They loved being a part of the group, and then I loved facilitating the group. So it was a great experience overall. Thank you. Next slide.
Thank you, Arminda. So my name is Katherine Perry. I was in charge of the high school group. These kiddos were pretty receptive to the information they were receiving. At first, they were a little like, this is kind of strange, but they adapted to it pretty well, and they started to really enjoy doing the self-soothing exercises. once they learned more about them. This is something we did every single lesson to start off and to end our lesson. So I think they got really used to it, and that was super helpful that they were practicing it day in and day out. They loved the body scan exercise. I remember the first time we went through it, one of the kiddos fell asleep and they're like, that was the best. So that was a really fun experience. And they kept asking to do that one over again. And they also like the focus breathing, or as they call it, the belly breathing, because they teach to breathe from your diaphragm versus from your chest in order to calm your system down. I found that they really enjoyed interactive activities the best. One of the ones that I remember was the music lesson. I will tell you, these kids taught me some great music, and it was just a really fun lesson to get to do together and teach how music can help to be just a joy in life, and also to help whenever experiencing maybe a trauma trigger. The most difficult lesson that I felt was the ACEs, like Arminda spoke about. I had preemptively felt a little nervous about the lesson, knowing the impact of what ACEs are, and thinking, oh my gosh, I'm going to administer this really heavy questionnaire to these kids. What am I going to do? Like, I don't want to trigger them. I don't want to make them feel traumatized. But once I went through the lesson and like read over it, I felt better, because the lesson actually doesn't have them go into their trauma history, which I think is really important, but rather educates them on the impact of trauma, what trauma is, and how resiliency skills they learn can help prevent the impact of potential trauma from continuing. So it became very much less invasive on them talking about their trauma, unless they were open to sharing with the group. This required a good amount of preparing for the groups every time. So we had to really be sure that we were reading over and going through the materials to make sure that we were ready to implement the activities for each lesson. Having the tools in place was super important. So having all of the materials that came with the Mind Matters, being sure that we had all of our extra things like the marshmallows and like candy and things like that, because it kept them engaged. It really super helpful. I truly felt that the youth gained skills and that they were implementing them into their day-to-day lives, which I found was a great experience. Seeing them actually using the skills was really rewarding. I was super nervous giving this group at first and just thinking, oh my gosh, are they gonna even do these things? And it was so cool to hear about how they used them at school. Some adaptations I felt that could be useful were to use language that was more familiar to kiddos, and because some of the curriculum can be a little elevated in language, so that can help for better understanding and relatability to the kids. But outside of that, the curriculum is super useful. I even use these self-soothing skills now. The one I went through earlier, the 5, 4, 3, 2, 1, super simple, and I'm like, man, this was great for me too, to learn these things too. And I was super appreciative of getting to do this curriculum with these kids. Thank you. Next.
Hi everyone, I'm Abigail. I was the observer for the program, so I got to see both groups in action, and I was able to discern the parallels between the groups as well as the differences. I saw that both groups enjoyed going through the exercises, especially when it came to the focused breathing and the body scan. And I also noticed the heightened level of excitement with the addition of the music, and that the introduction of the fidget toys was definitely welcomed and helpful among both groups of youth. I also observed that the adolescents had a greater attention span, which is to be expected for that age group. So when it came to longer lessons and more extensive materials, they definitely received it better than the pre-adolescent group. Though both groups did express a desire to have more interactive and even outside lessons. As the facilitators have described, when it came to the ACEs, that was definitely a difficult lesson for both age groups, and it was difficult just to sit back and be the observer in some instances, especially with the younger youth. Seeing that triggered response within that group, it was hard to just, again, be the observer without wanting to jump in and help. It seemed as if their that maybe a co-facilitator would be beneficial in that sort of lesson. Just someone keeping an eye out for that type of response in general, because of the difficulty there is with running any group while also addressing any potential response, especially when it comes to such a loaded topic. So perhaps a co-facilitator would be a good idea for any age group, especially for the ACEs lesson. Next slide, please. All right, so now we are going to do another exercise that is integrated into the program. This is the focused breathing exercise. So the purpose of this exercise is to calm the body and quiet the mind. Studies have shown that consistent practice of breath work can change the brain for the better, letting people think rather than react to situations. So here we go. I will now talk you through the focused breathing. At times I will talk, other times I'll stop talking so that you can focus on your breath. Sit quietly with your feet flat on the floor and back straight. Place your hands just below your rib cage with thumbs resting on the bottom rib, or rest your hands in your lap. As you inhale, breathe in slowly through your nose with your mouth closed. Feel your hands rise with the in-breath. Exhale slowly through your nose. Notice the hands moving inward towards the spine as you exhale. Breathe in, 1, 2, 3, 4. Hold, 1, 2, 3, 4. Exhale, 1, 2, 3, 4. Breathe in, 1, 2, 3, 4. Hold, 1, 2, 3, 4. Exhale, 1, 2, 3, 4. We will continue like this for a little longer. Again, inhale slowly through your nose. Don't rush or force the air. Feel your belly rise. Exhale slowly through your mouth. Feel your belly full. Continue to breathe. Breathe in, 1, 2, 3, 4. Hold, 1, 2, 3, 4. Exhale, 1, 2, 3, 4. Just a little longer and we'll be finished. Breathe in, 1, 2, 3, 4. Hold, 1, 2, 3, 4. Exhale, 1, 2, 3, 4. You can now start to move out of this focused breathing. You can wiggle your fingers and toes, open your eyes if they're closed, and breathe naturally. All right, everyone, thank you for participating. It's been a pleasure.
Thank you, Abby. I'm not sure if we have time. Rachel, I know I think I spoke a little too long. I got excited.
No, you did.
That was question.
Yeah, I say that was fantastic. We actually have one question that we can highlight, and if any other questions come in after, we can make sure that we get them to you for you to address. But one of the questions that I thought would be good to kind of point to that came through was if you can highlight or kind of note basically kind of the extent to which the curriculum discusses or at least points to the importance of creating healthy boundaries in relationships.
I know that's discussed, and I would welcome Katherine or Arminda, who went through the program in more detail through implementing it, to also speak to that. I don't know if either of you has a comment on that. I know it's discussed, I'm just not sure exactly how much. I think it's a great question though. I would recommend the other Dibble Institute, I swear I'm not paid to do this webinar, the other Dibble Institute programs that are specific to relationships though, such as like the Love Notes is one of those, Relationship Smarts Plus, they go into more detail on relationships specifically and relationship boundaries. And I'm in this work partly because most of my research is on relationship health. And I noticed that youth needed the kinds of skills and trauma recovery and healing delivered through this program to then really be more effective with those in relationship contexts. So that's my comment. It's not completely on the point of the question, but feel free to email me that and I can look specifically in the curriculum other ways.
No, you do make a great point at how this kind of starts by focusing on the individual and healing and growing the individual so that they can successfully navigate those healthy relationships. And also, as you're saying, that there are some lessons that talk about kind of assessing people in your lives and those support systems, and maybe those who aren't those support systems for you and navigating those. I think that is it since we are right on the hour, but if there is any other questions that come in, we will make sure that they get passed on to our presenters today. And I want to say thank you so much, Heidi and Abby and Katherine and Arminda for being on this webinar and really doing a great job at highlighting the program and the impact that it has had, especially during these very stressful times. So thank you to all of you for being here today. I do want to point out, for those of you who are still on the webinar, we do have a brief survey at the end of the webinar. We'd really appreciate it if you just took a couple minutes to fill that out for us. I also want to point out that the webinar recording, slides, and the resources will be available in the next 3 days on our website. You can see the link there on our slides, dibleinstitute.org/webinar-archives. If you've got any questions, you can reach out to our director, Kay Reed, or Esther. We'd be happy to answer those questions for you. Come check out our free Wednesday webinars, current research and networking opportunities. You can also get some CEUs. If you check out our free webinar sections, you can see there are credits for violence prevention and trauma-informed webinars, and you can get access to CEUs. Esther would be happy to answer questions about that for you, Esther at dibbleinstitute.org. And though we don't have our October webinar to point out, we do want to let you know what is coming in November, which is a really exciting webinar titled The Hidden Biases of Good People, an Implicit Bias Awareness Training. That webinar does cost $35 and it will be well worth it. So we hope you join us in November, and we also hope you join us at our next webinar in October. So thank you everyone, and have a great rest of your day.